So just to give a little bit of background, this is a project that started 7 months ago. As I was mentioning, we got 4 amazing nonprofits: Medic Mobile, Give Directly, Mission Continues, and I'm blanking because I'm up here, so yell it out for me. Thorn, of course, thank you. Thorn. I wish this weren't videotaped. But the way this went down was we got intrepid, what we call data ambassadors. And we put out a call for people who weren't just going to run regressions or put things through an SVM, people who were going to be able to shape these projects themselves. So they were thrown in with nonprofits with an idea of what they were going to do. Spent a couple of months looking through the data, figuring out what problems they could solve, and ultimately trying to put it together. They're kind of our data warriors, and I'm very excited to hear not just about the end result of what came out of these months of digging into data problems and coming back to rescope problems, as many people I'm sure here are familiar with, or just endless nights, Thai food, strewn across laptops, figuring out how to get things done. But also about that process. I want to hear, what's exciting is what these guys went through is a real process of starting to think about data science when you're not necessarily working with a company. You're just coming into a project, working with a team, and figure that out. So without further ado, I want to invite our first team up. Medic Mobile was run with Will Hyde and Kat Miller. And I'm going to turn it over to Kat to tell you more about their project. Give it up, Kat.
So we worked with an NGO called Medic Mobile. They're a technology NGO, and what they do is in developing countries, they enable communication between community healthcare workers and the citizens of the community. So in a lot of these places, there's a huge issue with transportation and healthcare workers being able to just communicate with the people that they're serving. Medic Mobile has great platforms. They have a mobile device, mobile chip that they can use. They also have platform technology that enables this communication to be done more easily. So an example of one of their projects, for women who become pregnant, they want to help them get the antenatal care that they need or that they should have for the health of themselves and their babies. So someone becomes pregnant, a healthcare worker finds out about it, signs them up for a program. It's a really simple text, it's just a couple pieces of information and they're signed up. And then over the course of the pregnancy, that woman will get reminders to come in for care. When she does, the healthcare worker will sort of close the loop and say, yep, that happened. And as a result, you actually improve the number of visits pretty dramatically amongst pregnant women in these communities. So it's just an example of one of the projects. They have many projects over many different domains, the kind of thing they do. So the goal for the project was really to allow them to measure impact, right? So if we go to a community and we increase the number of ANC, that's antenatal care visits, by 20%, I mean, that's a number, but what does that mean? And how do I communicate that? How do I interpret that, right? Also, there's a bunch of different things we can do. There's a lot of different ways we can spend money in the developing world in healthcare. What's our best bang for our buck? What do we really want to do that's most effective? And then furthermore, okay, so we're trying to be minimalist, we're trying to not put a lot of overhead on people, but are there other pieces of data we could collect that would really make this a better impact measure, that would make this a better program, that would help us improve it in the future? So that was really the goal, and you can imagine that measuring impact helps in all sorts of ways, not just with fundraising, but also in allocation of resources. We were going to focus on 2 main use cases. So I already talked about antenatal care, so that's just making sure that women get 4 visits or get reminders about 4 visits when they become pregnant. Another is childhood vaccinations. So we're looking at measles, polio, and pertussis primarily are the vaccinations that they were supporting. So these are both sort of childhood, maternal health cases. And so they said, well, there is this great tool out there, but it's kind of hard to use. So maybe you could help us out with that. So there's this tool called the LiveSave tool. It's out of Johns Hopkins. And it was developed using sort of the best knowledge at the time about public health to try to sort of aggregate the different healthcare impact measures that were known at the time, the different ways you could compute impact of interventions. So a great example would be if you provide a vaccine that reduces diarrhea in an area, and you also provide oral rehydration salts, which make you less likely of diarrhea. The fact that you did the first one actually lessens the impact of the second one, right? You can't just add those together. And when you're talking about doing a whole bunch of impacts in areas with different prevalence of blah, 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 becomes a huge thing. So this is a very massive tool that both integrates demographic data for an area, so it's the prevalence of disease, how many men versus women, what ages, etc. Also aggregates what I just said about different impacts and how they affect each other. And then using that, it provides an estimate of the lives saved by the interventions, and its particular focus is maternal health. So you're saying, well, okay, great, so that's great, that exists, you just put numbers in, right? Well, okay. So this tool has some pretty interesting limitations. It only allows projections in the future. It's intended to be able to scope future interventions, not sort of determine what the probable impact of a past intervention was. So that's like a little hairy maybe. It's intended for national projections. So you can ask, what if I raised the vaccination rate in Kenya? But you can't ask, what if I vaccinated 100 kids in Kenya or 1,000 kids in Kenya? It's not very easy to do that using the tool. And then, it's even harder if you say, well, I know we impacted 5,000 pregnant women. How do you even extrapolate, how do you even scale down a national projection to represent 500 pregnant women when what the tool is trying to do is say, I understand the population demographics in my area and I know how many women are likely to be pregnant and I'm going to calculate that for you. Right? So we actually kind of had to unroll some of what the tool was trying to do for you to make it easier in order to actually use the data that MedicMobile had. Additionally, this tool is written in Delphi, which I think maybe if you know that language tells you a little bit about the ethos that went into it. And it's not, it's not enterprise software. It's not like there's a whole team behind it who can give us support and make changes and is bug fixing all the time. So there's a little bit of a limitation in terms of the software itself and the design. So we said, okay, LiveSafe tool looks great. It does lots of powerful things that we can't do ourselves. But just in case, let's also do some research in this general area, make sure we understand sort of the greater scope of what you're trying to do. And maybe there'll just be some general research that will help you understand other ways to improve your impact measures and whatnot. So we were going to go through LIST. We were going to do a step-by-step, here's how you use LIST, and then also a sort of more researchy project about what else might you want to know in this area. So this is a screenshot of the LIST guide. This is done in RStudio. And the reason it's done in RStudio is it's very interactive. So the case I gave you before of the 5,000 pregnant women. So if you know the population of the country, and you know how many women you helped, you have to go through a whole calculation of crude birth rate, and you put it back in, and you divide it by the various things. So this is a very, very interactive spreadsheet. Or not spreadsheet, but a very interactive tool that sort of, you go through lists, you ask various questions, you put the numbers back in, you get them back out. And it updates the sort of PDF style thing on the right. And so this is to allow MedicMobile to sort of fend for themselves, basically. So given a new population, a new study, they can just sort of step-by-step go through these instructions, plug in the numbers, get the output numbers, put them in list, and get the answers they're looking for. So this is sort of to make them self-sufficient on list. We did this for both ANC visits, and we also did this for vaccines. We also, like I said, did this research project to try to see, are they doing the right things? Are they measuring the right things? Some of the big things we came up with. In antenatal care, actually, skilled attendance at delivery is a huge issue. Both having skilled attendance and also whether you delivered in a facility or not. So we suggested that potentially if they could collect just that information, that would also give them an idea if their population is more likely to have skilled attendance. That's actually a huge, huge impact on maternal health and how many women and babies die in delivery. We said that you can use LIST to calculate impact. It's a totally appropriate tool for this, as long as you do the necessary divisions and calculations. And then we also said, well, there's actually, what does it mean, antenatal care? There's a whole bunch of things that you might be delivering on a given antenatal care visit. We suggested they should really dig into what's being delivered in each intervention, so that they understand, were you giving syphilis treatment, were you giving, HIV prevention meds, so that they can sort of more accurately do these calculations. So those were our sort of data-related recommendations for antenatal care. For vaccines, one of the big things in vaccines is that children who receive the first dose of the vaccine don't necessarily receive the next couple. So this is actually a great, when you're giving reminders, this seems like a great opportunity for MedicMobile to be making an impact, but they're not measuring it. So we suggested that they measure how many children actually complete a series of vaccines, given that they started the first one in the program. Again, you can use LIST to calculate the impact measures for measles and pertussis. You can't really for polio, because actually the so low, and the reason we vaccinate is not exactly to prevent deaths anymore, so that one doesn't work so well. The other thing you can do is you can go to sort of calculated risk rates. So you can say, I know the prevalence of the disease, I know how protective this vaccine is against the disease, and you can actually just do a raw calculation that gets you pretty close to the number. And then the other thing we suggested was consider including the tuberculosis vaccine. It's very effective, and it and measles both have this sort of additional protective effect that seems to go beyond just protecting against that particular disease. So it's a very useful one in the developing world. We suggest that they consider interventions including that disease. In conclusion, sort of the total scope of what we did, quantitative impact measurement for Medic Mobile, which is also appropriate to other NGOs. There's nothing necessarily specific about what they're doing. If you have the same numbers as them, you can do the same kind of calculations. And that, because of the way list works, it allows comparison across different countries and also across different types of programs. So you can say this program will save 100 lives, this other one will save 300. You can do a comparison without really needing to do anything too fancy. The analysis is reproducible, so we give them these worksheets that they can use on their own without any further need of us. And then we give them a big picture context for what they could think about doing in terms of data collection and directions to go in the future. And that is the sum total of our project.